Welcome to Searchlight from Eastern State Penitentiary in Philadelphia. I'm Sean Kelly. Tonight's conversation is on the Pennsylvania Prison Society's work to track the threat of COVID-19 on vulnerable people incarcerated in Pennsylvania's prisons and jails. We booked our guest 2 weeks ago. Since then, the nation has witnessed the death of George Floyd under a police officer's knee in Minneapolis, and literally millions of Americans have risen up to demand an end to racial violence and an end to racial injustice in the United States. Although we didn't plan tonight's conversation against the backdrop of this moment in American history, this topic is part of that broader conversation. And with that, welcome again to Searchlight. I'm going to give a quick introduction to Eastern State Penitentiary and then introduce our guests. Eastern State Penitentiary is a prison museum in Philadelphia with its own troubling, fascinating, but often troubling history. Today, we give tours of the building. We host site-specific artist installations. This is Deonza Rogers' piece called #BlackGirlhood, been on view since 2018. We talk a lot about mass incarceration and the root causes of mass incarceration. This is our big graph that shows the truly historic rise in the rate of incarceration here in the United States in the comparison to other nations. Of course, there is no other nation that incarcerates even anywhere close to as many of its population as we do. And the north side of the graph shows the shameful racial disparities present at Eastern State in the 1970s, 1960s when the building closed, are actually growing worse with time. We have a companion exhibit called Prisons Today, Questions in the Age of Mass Incarceration. We are proud second chance employers. Our last big project was called Hidden Lives Illuminated, where we taught animation to people incarcerated in Pennsylvania prisons, and then projected those films onto the front wall of Eastern State Penitentiary last summer for a month. It was truly wonderful. We're closed to the public, like all museums in America, or most museums. We've put most of our programming is now virtual. We have a twice weekly 3-minute news roundup called Prisons and the Pandemic that covers the big stories of the week and the impact of COVID-19 on incarcerated people in the United States. We have a Twitter takeover called Hidden Histories on Wednesdays. This Wednesday is LGBTQ people incarcerated at Eastern State Penitentiary at noon on Wednesday. And we're re-showing those Hidden Lives Illuminated films. You can find all of our programming on the typical places. We hope you'll join us. Tonight's guests are from the Pennsylvania Prison Society. Claire Shubik-Richards is the Executive Director of the Pennsylvania Prison Society. Most recently, she served as Policy and Research Director for the National Campaign to Reform State Juvenile Justice Systems, a Washington, D.C.-based advocacy campaign to improve juvenile justice laws around the country. She's a graduate of Vassar College and of Boston University School of Law. She is a former law clerk to U.S. District Judge Stephan R. Underhill. Welcome, Claire.
Thank you.
And Joshua Alvarez is the inaugural Director of Prison Monitoring at the Pennsylvania Prison Society. In this position, Josh's work is to research, develop, and implement a new approach to how the Prison Society monitors prison conditions and advocates for policy change across the Commonwealth. Josh, it's good to see you. Welcome to Searchlight at Eastern State.
Thanks for having us.
You bet. Claire, I'm going to ask you just right off the bat, who is the Pennsylvania Prison Society? You and I both know that the Pennsylvania Prison Society sparked the construction of Eastern State Penitentiary 225 years ago. And so please tell us, who is the Pennsylvania Prison Society?
So we are the oldest human rights organization in the United States. We were founded in 1787, 3 months before the start of the Constitutional Convention. And our founders include Benjamin Rush and Benjamin Franklin, the founders of our nation. They believed that with the start of democracy, this perfect form of government by the people, that prisons would be humane places. And our Constitution, written by Benjamin Rush in 1787, says that our mission is to alleviate the miseries that are the natural attendants of public prisons, said in contemporary language, to make sure that prisons are humane places. Our secondary mission, in Rush's language and colonial language, was to promote those methods and degrees of punishment which shall be revealed to restore our fellow creatures to lives of virtue and happiness. Translated to 2020, we would say that's to promote rational and restorative criminal justice policies. So we've had the same mission, different words, but the same mission for 234 years. And today we effectuate that mission in three primary programmatic areas. One is working to end abuse in prisons, primarily through a network of 260 volunteers across the Commonwealth who monitor prison conditions, and Josh leads that portfolio of work and can talk more about that. Secondly is through programming that seeks to connect people who are in prison with their communities, their families, their communities, and with services that will help them transition back into the community. 93% of everybody incarcerated in Pennsylvania will return to the community. So we help facilitate that transition. And then thirdly, by advocating and educating around the issues that are our wheelhouse. And as you referenced, this week looks different than 2 weeks ago. We're still living through a pandemic, but our searchlight the public searchlight has shifted. And it has shifted to the issues that are central to the Pennsylvania Prison Society. We've been watching very disturbing images of police abuse that have been part of the spark to the movement that's taking place right now. Our volunteers are the only people that can bear witness to abuse in Pennsylvania's prisons and jails. So certainly the conversation that's happening right now has relevance for the work that we do, and we're delighted to be speaking with you at this moment.
Josh, can you tell us a little bit more about the process of entering Pennsylvania prisons? It's fascinating. I don't know if any other state in the United States has a program like this, but as I understand it, I think that your volunteers are able to go into prisons around the Commonwealth. And just like that brave girl who took the video of George Floyd's death, the witness is often the line between justice and injustice. And so Claire actually made that point to me earlier this week, and I thought it was fascinating that the echo of the nation witnessing George Floyd's death is played out all the way back in the founding of the Pennsylvania Prison Society. That the goal is to get these witnesses into prisons. And I'm sorry, I'm doing all the talking. Please tell us more about that work and its legacy and the form it takes today.
Yeah, so we were written into law way back in the day to really provide that citizen eyes and that citizen oversight into a closed institution. The understanding is without the public going inside and seeing what's going on is prisons tend to go bad really quick. And so the way that we do that today is we have these volunteers that respond to individual requests for help. We get hundreds of letters a month of incarcerated individuals writing into the society asking for help. We get hundreds of calls of family members concerned about their loved one who turn to the society for assistance. And as we get these ask for assistance, as we get these requests for help, we dispatch our volunteers who pre-COVID would be able to respond face-to-face. They would be able to meet directly with an incarcerated person, hear from them privately about their concerns, and then they, when appropriate, would go to the prison administration to ask those necessary questions. And so that's how we've done things. Currently, we are not visiting in person because of everything with the pandemic, but we are doing alternatives to in-person visiting. But that's how we do this work. That's how our volunteers go into the prison and bear witness to some of the abuses that might be happening.
Are you concerned that your inability to get into the prison could detract from the effectiveness of your work?
The pause of not going into the prison is temporary. We intend to go back as soon as we can. We just need to do it safely. We need to prevent any community spread from either the volunteers and the incarcerated community. And so we plan to go back. And I think the understanding with the state prisons as well as the county prisons, as they should make accommodations for us. They should allow us to continue to do this work. The society visited during past pandemics, and there's no reason for us to not do it now.
I'll just add that in the state facilities, we are visiting face-to-face. It's just over Zoom. So in the 25 state facilities in Pennsylvania, we are continuing face-to-face quick visits when we hear of a problem. It's not as good as being able to go into a housing unit when but we are meeting with people privately face-to-face. In the Philadelphia jails, they've arranged for us to meet confidentially over the phone. And in a number of other county facilities as well. So yes, it is troubling that we're not in, and it's actually our own decision. So by law, we have to be allowed in, and many county facilities have said, yes, you can come in, and state facilities have said, yes, you can come in, but we made the decision early on to only deputize a very small number of volunteers who are strictly social distancing from being able to go in face-to-face. I think we've had something like 2 face-to-face visits in the prison since the pandemic started. And we've really moved to try and do most of it remotely because, as we'll discuss, the way the virus gets into a prison and spreads is because prisons aren't totally closed. Staff are coming in and out all the time. New admissions are coming in, and that's how the virus gets in. And once it gets in, it spreads. And we didn't want to contribute to that.
Understood. I want to show a graph. We show this graph every single week on Searchlight. Sorry, the way this is coming up, it's actually blocking the end of the graph. This number just keeps going. These are numbers that come from the UCLA Law COVID-19 Behind Bars data. We actually had them on as guests here on Searchlight 2 weeks ago. These numbers are very hard to come by. As of yesterday, there were 46,000 infections that are known in American jails and prisons and 532 deaths. When we started giving Searchlights virtually at the beginning of this quarantine, the red line is people who are incarcerated and the blue line is staff. And when we started giving Searchlights virtually back in April, the numbers were almost identical. And we'll get to this, but it has just been so striking week after week to watch that red line just continue to climb. And week after week, we have guests on that say the infection rate of people who are incarcerated is anyone's guess because the testing is so low. And I'd be surprised if you're going to say anything different. But that number just climbs and climbs and climbs up to 46,000 as of yesterday of known infections with not a lot of testing. And so we were really fascinated when we heard that the Pennsylvania Prison Society was producing a map of Pennsylvania prisons and jails and making a very simple tool so we could track these infection rates here in Pennsylvania. So can you tell us more about the map you made and why you developed it?
So I actually want to say, Josh can talk a little bit and I'll put the map up here. One moment. I'll put the map up here for everybody to see. I just want to say one thing about it in the context of that graph that you showed. And that was part of why we put this map together, is we wanted to know. We're a part of the COVID-19 jail and prison reporting group that you just referenced. We've been contributing to it, and we wanted to know what that looked like in Pennsylvania. And so just to put that in some context, let me get the right.
This is on your website, to be clear. It's not a map that's on someone's wall. It's on your website and it's interactive. That's
right. And are you able to still see my screen okay?
It's zoomed in on the northwest corner of the state.
Okay, so it probably I probably can't do what I want to do. Sorry, now are you seeing something different? No.
No, we're seeing Venango County, Warren County.
Okay,
now it's the whole
now
map.
You can probably see everything. Josh, can you remind me what the total number of fatalities is of staff and incarcerated people in Pennsylvania?
It is, I believe, 13, I want to say.
It's in the talking points, 12, which I can't pull up.
12 people in custody have died and 2 staff have died.
So just to put a Pennsylvania twist on that graph that you showed, so it's 12 people in custody in Pennsylvania and 2 staff that we know, and we know that that's underreported. But
those are fatalities.
So and Pennsylvania has the 5th largest incarcerated population of any of the 50 states. That's not rate, that's absolute population. So that's sort of in keeping with where we are in terms of our size as a state. Pardon.
Please, oh, sorry, go ahead.
No, I'm going far afield. Let me redirect you to the question, sort of how I think we came about this a little differently than the UCLA group came about it. So I'll let Josh talk a little bit how we came to put together this interactive map.
Yeah, the whole purpose and the whole reason why we created the map was as the prison started closing and as communication started getting cut off between families and their loved ones, we received an unprecedented amount of calls directly to the society from loved ones asking what was happening. And in any given month, pre-COVID, we did about 200 requests for assistance from loved ones, want to know what's happening with their person on the inside. We started getting that same amount in a single week. And so as we started hearing things and collecting information, we started just doing a rudimentary collection. I remember the first article that was published about the virus being inside the Delaware County prison, and I remember having it on a Post-it note on my computer. And then we started collecting information because we knew that this would be being needed by the people that reach out to the society. And so we quickly realized there wasn't a single place where this information was being held.
Yeah, so the first thing that we did was we created an FAQs, which I'll scroll down here and you'll be able to see our FAQs. These have been up for a while, but these are the questions that we get inundated with on a day-to-day basis by family members caring about their loved ones on the inside. But one of the big questions that we got early on was somebody would call with concern that a loved one was sick or had reported having a cold or a sore throat, and they immediately assumed it was COVID. So we wanted to be able to tell them, every time we got one of these calls, we were calling the facility to see if the facility had done testing and what the facility could tell us about the viral spread, so we could reassure the family member. So that's what led us to start collecting information on a county by county basis. But the other question for us was not only in terms of helping an individual, but also in terms of tracking the viral spread across the state. And we're the independent monitors for prison conditions, knowing who was doing a good job, who wasn't, who was a hot spot. So that also led us to what we've got here. And I could say more about that or not as it's needed.
I think it's interesting that one of the challenges that the folks from UCLA talked about was just the different levels of government and their carceral systems and the level of reporting being so inconsistent between them. So you're tracking both Pennsylvania's state prisons, which is the bulk of people in the United States who are incarcerated or in state prisons, but you have all of these counties. How many counties are there in Pennsylvania? 60 or?
So there are 67 counties, 62 of them have prisons or county jails. So I think that's a really good point. So I think for understanding this map and understanding how the virus spreads, there's a difference between a county facility and a state facility, right? So a state prison, we have 25 in the Commonwealth, and they house people that have been convicted of a crime and are serving a sentence of 2 years or more. And what you see here is when there's a county that's colored in, it means the state facility in that county, again, there are 25 state facilities total, that the state facility located in that county does have the virus or has had the virus. So 13 out of the 25 state facilities have either had a staff person or an incarcerated person test positive. Then 62 of our 67 counties have county prisons. And those are facilities that house people that are awaiting trial or have been sentenced to a period of incarceration that's less than 2 years. So in Pennsylvania, given our sentencing structure, that's usually a more minor offense, or have violated the terms of their community supervision. They were told that they could be in the community and abide by certain rules, as their sentence. They didn't abide by those rules or something happened and they were sentenced. So what we see here is that 18 county facilities out of 62 we know have had the virus breach the prison walls. And you're absolutely right. I mean, it's really confusing. The state prison system, which houses about 43,000 Pennsylvanians right now, is a state agency, and they report everything uniformly. The 62 county prisons report 62 different ways. And one of the first things that we focused on was the fact that many of them weren't publicly sharing. So the state, the Department of Corrections actually, at our urging, created a COVID-19 data dashboard where they're putting their testing numbers and they're updating it almost daily. We asked them to do that very early on. We had seen that the Department of Corrections in Illinois had a data dashboard, and we asked the PA Department of Corrections to follow suit, and they did, and it's a very good one. I can show that to you in a second. But the counties, it was anybody's guess. And about 38,000 Pennsylvanians are incarcerated in county facilities on any given day. So all told, 1% of, or 1 in 100 Pennsylvanians, adult Pennsylvanians are living behind bars.
So your challenge with this, in your effort to respond to people who are concerned for the health, the lives of their incarcerated family members, you had to go and contact every county that has its own facility, and that is 62 counties. It's really just boggling that there's not some government agency doing this, but I think a lot of us doing this work really admire that you're stepping in and trying to collapse this data in a way that people can understand it. But what was that like, contacting 62 different county jails and asking each one of them for this data? Were they all cooperative?
Well, so I think that brings us to 2 points. I mean, so the first thing is, right, the PADOC, and I'll put this up. Are you able to see? Let me see if I can do this. Let's see. I think I can do this. Can you see? Did the screen just switch?
Yeah, we got
okay.
3 columns: green, blue, yellow.
Okay, so this is the Pennsylvania Department of Corrections data dashboard on testing in their facilities, and this is on their website. This is a new, even more detailed version than the first version that they were publishing. They started this, I would say, in mid-April, and when they started this, we asked the PADOC if they would publish similar information for the county prisons, and they demurred. And so then we were aware. Let's see if I can do another.
Do they have access to that? Does the Pennsylvania DOC have access to the county numbers?
They do and they don't.
Okay.
They do and they don't. They have a liaison with the county prisons, and we asked if the counties do have to report annually some information. And we asked them if their county liaison would assist us in getting this information on the spread of the virus. And they pretty much said, we're gonna not take you up on that request. But let me see if I can do a different share for you. Or if I probably have to do a little futzing here for a second.
That's okay. While you do that,
the one thing,
yeah,
I just want to highlight how valuable this information is. As we were hearing from family members about a loved one in a state prison, wanting to know if they were sick, or simply because you have to remember, as the virus grew more intense, the prisons went on lockdown. So individuals were in their cell almost the entire day. And so people that were normally calling their family members daily were no longer communicating daily. And so obviously there's some family members who are reaching out to us wanting to know if their loved one was sick, or if the virus is inside their prison. And because of the map, or because of the DOC dashboard, we were finally able to reference something official and be like, as of now, no, the virus isn't in this prison. And we were able to alleviate some concerns of family members. And so it's extremely helpful, and we wanted something like this for the counties. We got a few dead ends, and so we quickly realized that we needed to do something on our own.
So let me just make one more point, and then actually I think Josh has a really interesting perspective on your initial question, Sean. But after we asked the DOC and they demurred, we then turned to the Department of Health, because as you can see, this is the Department of Health website. And the two kinds of congregate care facilities where the virus will spread exponentially are nursing homes, long-term care homes, and prisons. And the Department of Health does a great job of showing testing results and viral spread in long-term care homes. So we then turned to the Department of Health and asked for their assistance. They, as you see here, they show it by county. These are county facilities, county long-term care homes. And so we thought they might help us get information on county prisons. Presumably, we figured they were getting it from the counties as they were reporting testing results to the Department of Health. They also demurred. It's sort of this issue of these county facilities are generally responsible to no one other than their own counties. And so that's when we decided that we're gonna have to create our own map. And then Josh can talk about what it's been like calling all 62 facilities.
Yeah, generally, the majority of the counties are willing to share the information. They just need somebody to ask. And so we've been pleasantly surprised with those that are willing to tell us what we want to know. And there are those counties that, frankly, don't get back to us. And there are a handful of counties that just gave us a complete no. They weren't willing to share even how they were going to try to mitigate COVID risks with us.
Yeah.
And so it's been an interesting experience as we've reached out trying to collect information that the families are wanting to know about.
We have a question here from Zoom. And by the way, anyone, either Zoom or Facebook, can submit questions, and I'll do my best to read them. A comment, the State Department of Health has oversight accountability for all individuals in PA, including those incarcerated. The department should be collecting data as they do for all the counties. Has the Department of Health been any help in this? Is that an avenue that would make sense to go down?
We've been liaising with them, and they have a great website. I think the way that they present data is fantastic. They demurred. They've been generally quite helpful, and on this opportunity, they demurred. It's a heavy lift to get information out of county prisons that are not used to reporting for anyone. And our two state agencies that seemed most appropriate to do it declined, and so we stepped in.
It's really depressing, but it's also encouraging that you're here and that you're doing the work, but that is really upsetting. Well, here's the question you probably should have gotten to sooner. Why are the infection rates higher in some places than in others? Which counties are doing it well, if there are any? Although I know from earlier conversations this week, there are some that are doing a good job, or relatively good job, and there's some places that I think you have some real concerns about. What are counties doing right? What is the state doing right to protect people when what's going well, and then what's not?
So I think the DOC overall, the 25 state-run facilities that we talked about, overall have done extremely well. So the infection rate statewide is 0.6%. The infection rate among people in custody in the state facilities, the 25 state facilities, is 0.6%. It's the same as the general population. And so that's really good news. The state was very, very smart early on in sort of basic mitigation, controlling who was going, limiting who was going inside the prison, limiting interaction, really making sure that people in prison have what they need to implement CDC hygiene guidelines. So lots of soap, everybody with access to a sink, everybody given a mask, both staff and people in custody. Everybody in custody given opportunity to disinfect their cells. Just really, the same things that we're doing on the outside, on the inside. And one of the things that we have done in addition to this map is we've been surveying people in custody. And I will say that people in state custody say to us again and again, we're told to wash our hands. We have enough soap. We're disinfecting. We're wearing a mask. If anything, the complaints have been about when staff don't wear a mask. I will also say about the state facilities is that they got testing really early on. So we were hearing from a lot of counties, the county prisons, that they just didn't have access to tests, and the state prisons did. So that's an example of where things are going right. And I think why in the state facilities, the infection rate mirrors that of the community. Now there are places that are hotspots where things aren't going well. I'll say something about two state facilities. Yeah, sorry.
Let's have a quick question. I've heard some pretty pointed criticism that the state of Pennsylvania has released relatively few people who would be vulnerable. And I appreciate all the positive things you're saying about the state. But I wonder how you feel about how the Pennsylvania Prison Society feels about the number of people from vulnerable populations who've been released from state custody.
Yeah, it's anemic and ridiculous. So, I mean, I think you're raising the good point that the first way to mitigate the spread in a custodial environment is to reduce the number of people that are in that dangerous environment. And I mean, here it's sort of flipped, right? So, what I was going to say is in terms of, if you think of mitigation as having sort of two prongs, one is get people out of the dangerous situation. And the second prong is for the people that are going to remain in the dangerous situation, make sure it's less dangerous for them. So in the state facilities, that first prong, forget it. In that first prong, we've got 43,000 people in state custody and something like 160 have been released because they fall into a vulnerable population.
Which is less than 0.1%, right? Something.
I have the number here, but it's much less than 1%. But now let's look at the county prisons, the 62 county prisons, where about 38,000 people are in custody. Well, in many of those county prisons, 30% or more of the so they took a 30% or more reduction in the total number of people in prison. And that's actually something we also show on the map, and I can put that up. At the same time, there were a number of counties that they reduced their prison population dramatically. I mean, 30% or more. But in terms of implementing the public health measures to keep the people that are still inside safe, that's where a lot of the counties were severely lacking.
Is it easier to release people from a county prison since so many of them are pre-trial? And is it harder to maintain routines since the population is changing much more frequently? I'm just guessing, but whenever I go into a county prison, I'm always amazed at how much more chaotic. Many people are just arriving. People don't plan to be there long. They haven't gotten used to the routines. And county prisons, in my experience, was nothing like yours, tend to be more chaotic and just a much more transient place. I wonder, do you think that 30% reduction rate in some counties is simply because that it's easier to find ways to get someone out of the prison if they're pre-trial, for instance? And is it harder to?
Yeah. I mean, what I found fascinating about this is that, and we're actually going to be putting out a memorandum about this with the Vera Institute, is that it is easier for people to be released from county prisons. And I don't just think that that's because there are people who haven't been convicted of a crime. I think it's because the stakeholders that can release someone, right? The prison, under normal circumstances, can't release somebody. It's a judge who can release someone. And the judge typically won't release someone unless the district attorney and the defense have come to sort of an agreement. And in a county, particularly a small county, all those stakeholders know each other. So it's much easier for that group of people to come together and decide we got to do something. At the state, it's much harder. And in fact, you saw that here at the state. The governor only took action after both the Pennsylvania Supreme Court was asked to order the release of people from state custody, and they declined. And then the legislature debated for weeks about ordering the release of people from state prisons, and they declined. And finally, the buck got passed to the governor, and he actually did something. So, praise to Governor Wolf and Secretary Wexel for actually doing something when the buck got passed from the two other branches that would be more likely to take action. Now, the action that they took, the governor's reprieve, it's only resulted in 100 plus, 160 odd, 180 odd people being released. It's been anemic, it's been insufficient. But it was some action after the other branches of government declined.
Okay. Sorry to pull us down that rabbit hole. I just wanted to give you a chance to respond to that. So which counties are doing well? Josh, you're the one who's been calling the counties, as I understand it. Where do you see counties being responsible and getting this right, relatively speaking?
Claire, do you want to pull up the map?
Sure.
Again. One of the things that we try to demonstrate is the reduction in population. So if you go to the map, which is on our website, you can toggle over to kind of like in the cases where people have change in county population. And so you can see, obviously, like Allegheny is a place to highlight. I forget the name of this county that's deep blue and northwest. There you go, Butler, or Verango, I'm sorry, Venango. And so this map demonstrates where places are the counties that are doing well. And so we obviously applaud and we commend them for decarcerating and getting those vulnerable members of their community out of there. And so, yeah, so definitely take a look at this portion of the website, and you can see how your local county is doing in terms of getting those people out of the prison.
You want to call out a county in particular you think is doing a relatively good job? I don't want you to put you on the spot.
Go ahead.
Hey. Okay.
I think this shows you where counties have reduced their population. And I think what surprised me about this, because again, we're the only people collecting this information, was I'd seen news reports about the reduction in Allegheny County. They've got a very active press. They were reporting on it. And I assumed when we set out to collect this information that they were going to be an outlier. But what we see is that they're not. Is that big and small, urban, rural, west, east, north, south counties all across Pennsylvania reduce their populations safely, right? We haven't had a massive crime wave, have reduced their population safely in response to the pandemic. So that's the first prong of mitigation, right, is reducing the population. But the second is then how are you keeping those people that are still on the inside safe? I think part of it, Sean, is not only their county jails more chaotic, but many of them are set up in big open areas, dorms. So I'll just say right now, let me find, oh God, I mean, some of these counties. Anyway, so some of the things that we're seeing that are great and some of the things that we're seeing that are troubling. There were a lot of counties who reached out to us really early on and said, Westmoreland comes to mind, says we're screening every staff person before they come in. We're quarantining everybody for 2 weeks who's a new admission. We're taking sort of practical measures. But then we're hearing from other counties with our survey from incarcerated people who are telling us we don't have access to soap. Or we don't, the guards are told they're supposed to wear masks and they're not. Or we're just in an open dorm and there's no way to social distance. So we're seeing that. I mean, I think, it was Delaware County and Montgomery County where the virus got in the earliest and it spread the fastest. I think those counties after the fact did a really good job of testing and trying to figure out where the virus was, but they let it get in there. Yeah, Josh, anything you'd add to that?
No, the only thing that I would say is this website is a tool. And so one thing we haven't demonstrated is the fact that there's information behind all these. It's an interactive map. So as you find a county and as you click on it, the specific county, you're taken to a page that's going to show you whether or not the virus is in the prison. It's going to cite the sources of where we got this information. It's also going to show you the population level since the last time, the pre-COVID population level. And so it's meant to be a resource where you can find information, like a catch-all for all COVID, the things that we're hearing. And you'll see a listing of the county and the different news clips and stuff like that. So it's really meant to be a tool to help concerned citizens really understand what is happening in their local prison.
It's really amazing. We have a very specific question from Facebook from Scott, who asks, how did Luzerne County decrease the population? I don't know whether you want to click over in the map and if there's anything in there that can show the actual method that Luzerne County apparently used to reduce their population. And while you're doing that, I think a lot of people, I actually am not always entirely clear, when someone is released from, let's say, from the Commonwealth because of their vulnerability to the virus, are they expected to complete their sentence afterwards? How does that work at the Commonwealth level? And how's that working typically in the counties?
That's a great question, and I'll answer that, and then we can talk about Luzerne, where we actually don't have information on the reduction in their population. But at the state level, the 100 odd, again, I should look up that number, 160 something people that have been released. Here we go, I'll get the exact number, 159. The 159 people who have been released to date under the governor's reprieve will be expected to return to prison unless the legislature passes a provision that will allow them to remain in the community. So, and in fact, their sentences will be lengthened because their sentences are essentially been put on pause. So when they return, they will have to serve as long as they had to serve before they left. So in fact, these people are being penalized. They're showing that they can safely be back in the community during a global pandemic. And they have to come back and now serve an extended period of time in prison. In the counties, it's all over the place. So there have been a variety of different mechanisms used to bring people home, and it's on a county by county basis whether they'll have to go back or not.
Got it.
I think in referencing the Luzerne question, as we mentioned earlier, those places that are willing to share the information, we've been able to get that information and we've been able to put it on this map. There are a handful of those counties that unfortunately haven't been as transparent. And so as you look at the county map, and if you look on your county and there's not information, it's probably because they either didn't get back to us or they refused to give us information.
And Sean, you asked what counties are doing great and what counties aren't. And I think the one area where I know I can grade counties right now is on their transparency. And they're willing to say to the public, this is what's happening with your taxpayer dollar and to your fellow citizens who are incarcerated. And an A+ for transparency would go, now there are other problems with these counties, so I'm not saying they get an A+ all around, but would go to Centre County and Chester County and Allegheny County, all of whom are putting very accessible information about the spread of the virus in their prisons on their websites and updating it on a regular basis. The counties that would get Fs would be Lackawanna, Lebanon, Luzerne, Huntington, Potter. These are all counties that have said either we're not going to give you that information or you need to right to know it. You need to FOIA it. And what I'd say is particularly troubling about that is many of these counties, particularly Lackawanna, Huntington, and Luzerne, are in parts of the Commonwealth that have very high community infection rates. So it can be inferred that their prisons have that too.
That is really interesting, though. That transparency question as a grading point, I hadn't thought about that, but it is really interesting to think about that alone being a sign of the willingness of people who are responsible for the safety of fellow citizens. So I applaud you for thinking of that as a metric. I was thinking about what it'd be like to have, if you were calling about an elderly loved one in one of these places, and just if you're getting so little information, it's hard to imagine what would happen if just someone's family member called up. Where do you see this map going? It would be really wonderful to think this map in its current state wouldn't be necessary in a year or 2 years, God willing. What are your plans for the map, how it might evolve as this crisis, we hope, God willing, winds down for people who are incarcerated?
So the map was created to really kind of share information with the broader public and to be a one-stop where someone can figure out just kind of the happenings in terms of the virus at their local prison. But I think moving forward, we want this to be a continual resource for the broader public. For example, say someone is unfamiliar with what's happening at their local prison. You probably don't really know what's happening until you have to know what's happening. And so we hope that by collecting information and putting it in a single place, someone could quickly orient themselves to their local issues and those local things of concern. As you see in the Montgomery County page, you can see all these news clippings. You also see some other resources of like the jail website and like the public defender's website. And so we really hope this will be a tool for the public or concerned advocates to really learn as much as they can about the prison in their backyard.
Do you think that there's any chance that the people who run some of these county prisons and jails might see this map as a bit of a shaming, or like when they realize that all the other counties have been contributing their data and they're not doing it? I'm not sure if that's part of your strategy, but I would hope that some of the counties who have been so resistant to any kind of transparency would realize that they're outliers and that the other counties are participating. Is that part of your strategy?
I mean, I think it's also to praise those counties that have been extremely forthcoming. So we started on March 13th was the day that everything kind of hit. March 13th was the day that the Department of Corrections announced that there would be no outside visitors in the 25 state facilities. And the second that happened, we started calling every county and emailing every county to find out, were they allowing visitors and what were they doing to mitigate? And a handful of counties, I'm going to say around 10, got back to us right away and wanted us to be sure that we knew what they were doing and we could communicate that to families. Josh can maybe look up who those initial counties were, but I really want to hold them up. We used what we learned from those counties and we combined it with information that we had been gathering. We have sort of an informal advisory group of epidemiologists and correctional medical professionals who we use to help us understand the spread of the virus. And we used what we were getting from these initial counties and our expert advice, and we issued guidance to county commissioners on what their counties should be doing. And we highlighted those counties that had actually gotten back to us. We wanted their county commissioners to know that their wardens were responsive and their wardens had nothing to hide and their wardens wanted to learn. And as a result of the guidance that we issued to county commissioners, we got back another tranche of counties reporting out to us. And we had several counties adopt best practices that they hadn't previously.
That's really, really impressive.
And I would just add that I hope, never mind the shame thing, but I just hope this would encourage counties to be transparent. Citizens should know what's happening in these prisons, and they should know what's happening to their loved ones that are on the inside. And yeah, we did have a large group of counties from Beaver, Blair, Center, Erie, Franklin, Lancaster, Lycoming, Mercer, Mifflin, Snyder, Union, Westmoreland, and Wyoming, who responded to us right away, and then who wanted to give us updates. And so this transparency should be applauded. It should be encouraged. They're willing to let us know what they're doing now. And so for those counties who have been a little bit more challenging to get information out of, I really hope something like this would put some pressure on them to be like their peers. And for the concerned citizens in their community, hold your prison accountable. This information should be out there for the families and for the people that are concerned.
Thank you for putting such a positive and hopeful spin on that too. We are running out of time. I have one more question from Facebook, and I have a final question of my own for the two of you from Facebook, actually from Zoom. Any idea why the governor released eligibility standards for a very large group of people, but then actually released so few here in Pennsylvania?
So the eligibility what this person is referencing is that the press release that the governor and Secretary Wexel put out when the governor announced the reprieve process estimated that between 1,200 and 1,800 people would be eligible, and somewhere around half of that number would be released. So half of that number is right around 600 people. Well, as I just said, we're at 159. So even that modest 600 has not been achieved. I think there are two things going on. One is that the criteria is actually very, very, very involved. And it not only is related to what the person was convicted of, if they are in a vulnerable health group, but what their disciplinary record was like in the prison. A lot of information that the prison couldn't just call up. They actually have to do research on. So I think they misunderstood their own data and who was going to be in that group. I think the other thing is that they're only putting people up for reprieve if that they can get consensus from the convicting county's legal community, criminal legal community. And so I do think that there are, again, I think this is a small number, but there are a number of cases in which the State Department of Corrections recommends someone for reprieve, and the county's criminal justice community objects.
We're out of time. I've got one final question. What can people do if people are concerned about the response of the county correctional system or of this Commonwealth in this crisis or any other? How can people help change the system? Josh, you were sort of going down this road a moment ago. You want to finish your thought? A minute ago, you were talking about how people should hold their public servants accountable.
Yeah, there's a variety of things we can do. Obviously, support the work that we do at the Prison Society. Follow us on social. Sign up for updates. Learn as much as you can about what's happening at your prison. The first thing that you can do if you want to advocate is really just to inform yourself. And I think the tools that we have set up lend itself to that. We do our best to share everything that we hear with our community, and we are committed to that. We strive to be an unbiased source of truth about what is happening on the inside of these prison walls. So definitely sign up, and you'll get different ways on how you can be involved, even on the volunteer side, how you can be involved in going into your local prison. But the best thing to do is just inform yourself and go from there.
That's great. Claire, anything to add?
Well, I think, I will add two things. I mean, one is, we talked about how the Department of Corrections would not collect this information. We talked about how the Department of Health would not collect this information. We talked about how there were a number of county prisons that once they heard from us, once they got guidance from us about what their peer prisons were doing, started to implement positive measures, but it took us telling them. One would think that collecting this information and providing guidance would be done by a public agency, but it's not. It's done by us, Citizen Prison Monitors, a non-governmental, nonprofit agency. So, firstly, if you think that this work is meaningful, please do support us. We are based purely on the generosity of community members who think that this work should be done.
Okay.
And we're working hard to do it. But then to Josh's point, yes, go see what we have about your county on this map. And if there's something that you think is there that's missing, you can either let us know or write your county and see how your local tax dollars are being spent and if they are responsive to citizen inquiry.
We'll have to end it there. This has been such an interesting, disturbing at times, but interesting conversation. Thank you both so much for doing this work. Josh Alvarez, thank you. Claire Shubik-Richards, both from the Pennsylvania Prison Society. Thank you for joining us on Facebook, I almost said on Facebook, on Searchlight from Eastern State Penitentiary Historic Site. Thank you both so much. Have a good night.
Take care.